today we'll be tackling a critical issue that did spark outrage on social media a couple of days back. Now, I'm talking about the story of Kemi Folajimi, a pregnant woman who tragically lost her life due to the inability of her husband, Akim Bobola Folajimi, to pay a deposit fee of 500,000 naira before receiving treatment. Now, this has brought the issue of medical facilities requesting for deposits before attending to emergency cases to the forefront. And this heartbreaking incident has raised questions, fundamental questions about our healthcare system and the ethics of prioritizing payment over patients' care. Now, according to the World Health Organization, Nigeria's healthcare system ranks 187th out of 191 countries in terms of healthcare access and quality. Furthermore, the National Health Insurance Scheme covers only about 5% of the population, leaving millions of Nigerians vulnerable to financial exploitation in the pursuit of medical care. Now, the pay-before-service model has become a stark reality in many Nigerian hospitals, with patients often required to pay hefty deposits before receiving treatment. Now, this approach has been criticized for being unethical as it prioritizes financial gain over human life. But what does the Nigerian medical policy say about emergency cases? Now, according to the Nigerian medical policy and the Nigerian Medical Association Code of Medical Ethics, a doctor is duty-bound to render emergency care to any patient who presents with an acute condition, regardless of their ability to pay. Moreover, the National Health Act of 2014 states that no person shall be refused emergency medical treatment on account of inability to pay. So, what happens when a medical facility refuses to treat a patient in emergency need, resulting in the patient's death? The penalty for such negligence can be severe, and the National Health Act provides for fines and even imprisonment for healthcare providers who fail to provide emergency care. So today we want to hear from you as Nigerians. What is your take on this? Is pay-before-service model in Nigerian hospital morally justifiable? Should patients be required to pay for treatment before receiving care, or is this approach a clear violation of the fundamental human rights to health care? We want to get your thoughts. Our lines are open. The phone lines are open. Our WhatsApp is open. So do well to send in your messages on WhatsApp and also calling. Let's hear your thought. Let's get the conversation started. Is pay-before-service model in Nigerian hospital unethical? Have you experienced it, and how did you feel about it? What's your take on that model? Now, I'm going to share a brief personal experience. A couple of weeks back, I was in a situation where I needed medical attention, and it was a near emergency case. But what I realized was that when I first got in, paid for consultation and all whatnot, but I paid for every single thing needed in the hospital. I'll continue on this, but let's quickly take this call. Good morning. Tell us your name and where you're calling from.
Good morning, Lilian Ogazi. I'm speaking with Shetima Yakudima, calling from Maiduguri.
Good morning, Shetima. Thank you for joining us all the way from Maiduguri. How is Maiduguri this morning?
Maiduguri is okay. Maiduguri is cool. We thank Allah.
All right, go ahead with your thought.
Honestly speaking, these hospital issues, you see, Lilian, ethic of profession is lying on paper, but what they are doing is contrary to the ethic of profession. I don't know whether they did not receive orientation before they start their working. I don't know whether it is a negligence. I don't know. Just look at it now. That woman that lost her life for deposit of 500,000. 500,000 nowadays, is this an easy thing for somebody to get? I think the best way is you treat somebody first, and then later on you claim your money as the way that the ethic of profession has explained. But they are not doing it. And Lilian, our surprise is medical line become an exploitation line. They put mercy aside. They put pity aside. What they're after is money. Money, money, money. You know, if you are sick, you are desperate. No matter how much bill they give you, you are ready to settle because your health matters for you. And I was surprising. A health personal person doesn't have pity. He doesn't consider life. How can you neglect somebody? And you are seeing him struggling under pain up to the level that he will die without even care. It's very, very unfortunate. It's very, very unfortunate. And you see, Lilian, our government have to do something. Look at a poor country like Niger. If a Niger can give a subsidy in the health matter, in the health sector, why not Nigeria? Why not Nigeria? Look at our aged people, our retired people, pensioners. They are struggling with hospital bills, and their payments cannot even buy paracetamol. I know there is pensioners who are receiving 4,000 naira in a month. 4,000 naira, Lilian. It's a pity. It's a pity. It's very, very unfortunate. I don't know why we are so wicked to ourselves. After all, the country is rich. And we are so wicked. I don't know where our sympathies mind goes to. We have to sympathize with our brothers and sisters. We have to be kind to our brothers and sisters. That's the removal of foreign subsidy. That is where they're supposed to channel it. You channel this subsidy to the health partners, to the health facilities. They should do something about it. It's rather unfortunate, very, very unfortunate. They should try and do something, please, as quickly as possible, because more lives have been lost, and we are still losing more lives.
Indeed.
Thank you so much. That's my take this morning.
Indeed. Thank you so much, Shettima, for your take. Indeed, he has spoken about how most medical facilities are money focused. Now, where I was leading with on my story is going to link back to what Shettima said. So the hospital I went was the same hospital I gave birth to my kids in. And when I came back for an emergency after giving birth to my child, they just attended to us, gave us a room, got the phototherapy lights, and set us up. It was a newborn. It was like 4 days old. Started receiving treatment even before they said, okay, this is how much it is. Go and pay here and go and pay there. That was when that happened 2 years ago. But going back to that same medical facility sometime this year, a few weeks back, I wasn't given a room. I wasn't attended to till I made payment. And I asked, why? What's happening? In fact, the last time I was done receiving treatment and I was discharged before I made payment. That was how much they prioritized the health of me and that child. But this time around, they wanted their money first. And he explained a rift between both parties. That's the patient and the medical facility. I'll get to that right after this call. Let's take the next call we have this morning. Good morning.
Hello?
Hello, good morning. Tell us your name and where you're calling from.
Something is my name. Hello, good morning. Yeah, my name is Samson.
Good morning, Samson. Please, can you turn down the volume of your TV set? All right, we lost Samson. Samson, please do well to call back. I'd really love to hear your thoughts. And when you do so, kindly turn down the volume of your TV set and talk to us through your phone. Now, back to where I was. I said when this time around they didn't attend to me. They did attend to me. I got consultation because I had paid for that, but I was admitted and I had to pay for a room. And I said, okay, I want to see the room and let me get settled in so treatment will start taking place. And then I'll make you transfer while in bed. And I said, no, ma, you have to pay first. And I said, but the last time I came, said yes, because they've had patients run away from the rooms without paying because they were lenient enough to give you medical services knowing that you needed it and it was an emergency. And they've had patients run away without making payment, not once, not twice. So where does this leave the medical facility, and how do you expect the hospitals to function if such things are still happening? Let's take the next call. Good morning. Tell us your name and where you're calling from.
Okay, good morning.
Good morning.
Okay, my name is Comrade Akayata Gospel Obinna. I am calling from Rivers State.
Good morning, Comrade Obinna. How is Rivers State this morning?
By the special grace of God, Rivers State is good and calm.
All right.
Despite whatever thing that's happening, despite the state of emergency, everywhere is calm. People are going about their normal businesses.
Okay. Okay.
To the glory of God, I would believe that there will be a better River State.
Indeed, there would be. We look forward to that. So, what's your take on our topic of discussion this morning?
Okay. From the topic this morning, healthcare service, is pay before service untechnical? Let me go by the question. The answer to that question is yes, very untechnical. In the sense that, come to think of it, where I am getting more surprise, is most of these missionary hospitals that is expected to be a free medical center, at least for the citizens, knowing too well that the tithe and offering of those individuals that happens to be the member of those religion centers was used to build those hospitals. I cannot just imagine how people can be dying in hospitals like this with a condition of pay before service. And you see some doctors who are working in these respective hospitals that are supposed to be strictly free for the citizens. They will always place a dying patient that came maybe somehow because the place is hospital. The hospital is built for free services to the individuals. Now, unfortunately, they die because they couldn't afford the money to pay before they render services to the dying patients. Away from that, come to government hospitals. Come to Rivers State as a case study where I came from. There is no equitable service, as equitable machines in most of these hospitals. In fact, it's very rare in Rivers State for you to get, or for you to have a very standard, well featured with equipment hospitals in Rivers State.
Do we still have, comrade, I would have loved to hear the concluding part of your thoughts. Do well to call back and, let's hear the concluding part of your thoughts. But indeed, he has spoken about, even missionary hospitals that have been established. But one question though, these hospitals are not run on water. The employees are not paid with leaves. So if, especially for private hospitals who prioritize who give proper healthcare services. I narrated my experience and saying that the reason why these hospitals stopped doing or pay when you're done with your emergency case and you're sure that you're good to go and you're ready to start your payments, your child or you yourself, you've received the first set of treatments, then you can start your payment. They stopped it because people were running away with their money. People would find a way to escape and not make their payment when necessary. That was happening. So imagine how many of this is happening across the country. The hospital is running on resources. It needs light. It's running on electricity. It needs light. It needs medication. It needs the technical hands. It needs equipment. The lab needs to be running and functioning. A lot needs to be put in place. But when it comes to medical services, it is believed that at least the basic to save that life at the moment should be carried out. But let's take the next call we have this morning. Good morning. Tell us your name and where you're calling from.
Mimi baby, this is Abasekong.
Good morning, Abasekong.
Hello, calling from Gombe State.
And we know you are from Gombe. Welcome.
Okay, the fact remains that I really want to appreciate the governor of Adamawa State. This morning I saw when you were running the commentary of the medical center he was putting on ground, and to be attended by the people that are Yola to enjoy it, and that they've been coming to Gombe for treatment, and that is a visionary governor. I applaud him for that. Yes, coming straight to the question. The question is that it is in two ways. One, the government needs to subsidize health care.
Indeed.
He needs to do it. What are we benefiting? What are we benefiting? I remember you told us a story about your mom. She used to travel by flight to go and visit your siblings, your brothers. Eventually, there was tariff. Okay, she was putting up plans to go by road. They now increase transport. Now, she also wanted to make calls. There was tariff. So where are we heading to? So the fact remains that until something is done, if not, I don't blame hospitals when they say pay before service, because those people that are working, they need to be paid. The lawyers, the doctors need to be paid. That is why we are having Japa syndrome. A lot of people are leaving the country. So if they don't pay them, how and when they don't buy the equipment that needs to be used for the treatment, where is the money going to be raised? So my sister, sincerely speaking, a lot needs to be done. It is the federal government that needs to take this responsibility. So I don't blame those people when they say they must pay. Why am I saying so? If it is emergency, they must give first aid. First aid. But if it is not an emergency, you find out that, like I watched one of your programs, a woman gave birth to how many children? When they asked her to come and pay, she ran away, they could not see her again. So these things need to be redressed. The federal government needs to, double into this situation and address it. Sincerely speaking, like now, I want to visit the hospital. I always visit the hospital, kind of making them to energize them. Even though I don't have money, but at least let them feel the presence. We now pray, and as a retired, I don't have any work doing. As a retired man, how much is the salary?
Yeah.
It was Shetima that pulled me out from my shell as a tortoise. He pulled me out. That is why I'm making this call. I really want to appreciate Shetima. He has been contributing positively. Very wonderful and dynamic speaker. You see, the fact remains that until we change our myopic sense of reasoning, things will not work out.
Indeed. Indeed, Abasekong, thank you so much for that. He has said that changing our myopic sense of reasoning, the way we think and see things, sometimes it's good to look at things from both aspects. Like he said, he brought it back to the government. Healthcare is a basic need that should be affordable to all. I say this, nothing should take you to the hospital. Health is wealth. If you have a means of taking care of yourself and keeping fit, pray never to have an emergency that would take you to the hospital. I know how much I spent in the hospital the past couple of weeks, and I'm wondering, what is it just because of malaria, or basically malaria, that I spent this huge amount on being admitted in the hospital? Healthcare is expensive in Nigeria because the hospitals are not run on waters. Let's take the next call. Good morning. Tell us your name and where you're calling from. Please, can you turn down the volume of your TV set?
Yes, it's turned down.
All right, talk to us.
This is Easter Sunday. You're calling from Nazareth.
Good morning, Sunday. Go ahead with your thoughts.
Yes, I'm watching the program here. The question before us is healthcare services healthcare services is paid before service or service unethical. Whether it is unethical or not, the truth remains that we as Nigerians, we must change. You know, when the right thing is not done, that I believe some of these medical health practitioners do change as well. For us to do the right thing, I have seen cases where more especially the private healthcare I do attend. Whenever I carry my wife or any of our siblings to that clinic, with money or not, they do attend to me. And the reason is simply because at the end of the day, the person in charge believe with me that I will not go to anywhere. The services rendered will be paid. But there were cases too where whenever such services are rendered, those people will just disappear without settling those things or those services rendered.
Indeed.
So number one, we are citizens. We must do the right thing, whether it is unethical or ethical. The main thing is we must, as a matter of fact, whenever we are going to hospital, we should know that we must prepare to pay to have money with us, because as we are going there, money is involved, and we shouldn't expect such services to be free. It is not, I don't think going to hospital, be it government or private, I don't think it is free. There are things that need money. And when money is not involved, I don't think hospitals or private clinics will be run. So we must do the right thing.
So but how about in cases of emergency? Say it was a medical emergency.
If we have cases of emergency, for example, as the last speaker rightly said, there should be first aid.
Yeah.
I believe it will not cost much. There should be first aid first. When such first aid is rendered, then the person that brought the patient to the hospital should also go prepare him or herself to raise money, because as far as the person is there, money is involved. In fact, this reminds me of a case that happened 2020. I took my younger sister with my parent to the specialist hospital we have in Lafayette, now teaching hospital. Do you know when we got there, they could not attend to her. We need, how many of us that day, 3 or 4 of us, we need to go here, go there, you make this payment, you go to another unit, you make different payments. May I shock you today, after all this payment, buying all that needed for her to be treated, she lost her life. I'm telling you the life story, what happened, I was there. At the end of the day, none of those things we paid, none of those things that were all those things that were brought, nothing, none of them was used. When I left the hospital, I wasn't myself. All this delay, if really they would have attended to her before the payment, nobody can tell what would have happened.
Indeed.
But because the doctors, the medical personnel, the health practitioners are just after money. But money can also play its part. But we should remember that human beings generally, for us to handle a human being, life of a human being is very important than the money itself.
Indeed.
So the health practitioners too need to be passionate in their profession.
All right. Sunday, I'm so sorry for your loss, and it's quite disheartening that you did actually went the length to make all the necessary payment, but because there was a certain lackadaisical attitude that led to the loss of the life of your sister. We hope God gives you and your family the fortitude to bear the loss. All right, let's take the next call we have this morning. Good morning. Tell us your name and where you're calling from.
My name is Gideon Usman. I am from Adamawa State, calling from you.
Good morning, Usman. Go ahead with your thoughts.
Concerning the healthcare service, it's very, very unfortunate to see that the masses are suffering without attending the medical practitioners concerning the situation and the level of inability to have cash at hand. I know as Nigerian good citizens, God has given us riches. God has given us everything we have in order to take good care of our people. But if you look at the situation we're facing, you see that health delivery is not up to the standard to Nigerian people. Go to the developed country, you discover that the priority of that country is first the health and how their people are living well. But in Nigeria, reverse is the case. Why is that such kind of thing is happening? Why is our Nigerian government are not working towards this aspect? Look at the scenario that is happening at the Northeast. Look at what the insurgency is doing. Look at how poverty has increased massively. People are suffering. Why is this happening? Is democracy doing well for Nigeria? You look at it, you see that they have introduced this healthcare scheme. They have introduced insurance. And if you go to hospital, there is no search for less privileged people. Look at how pregnant women are suffering. Look at how delivery system is. You see all these things. We thank you because you put this online so that people will know, yes, what does government do for its people.
Thank you very much.
We appreciate you because of the wonderful things you have done. And we know if you keep on doing that, it will make enlightenment. And that people will see, and even the government will come in order to intervene, in order to do well-done job for its people. Look at how people are suffering. Look at the weather we are now.
All right. Thank you so much there for your thought. You know, it's disheartening. It's a two-way street, I would say, but emergency services are very essential. Actually, something that could just save lives. We have a couple of WhatsApp messages. We see our messages coming in, and we'll take them shortly. So we'll take all the messages shortly. But let's take this call. Good morning. Tell us your name and where you're calling from.
Hello.
Yes, good morning. Tell us your name and where you're calling from. Please turn down the volume of your TV set.
Really? When it's off already? I don't need to be told that. I know that already.
All right.
Good morning.
Good morning.
How are you?
I am fine, thank you.
Good. My name is Ade. I'm calling from London.
Good morning, Mr. Ade. Thank you so much for joining us this morning.
Happy weekend, yeah.
Yeah.
My view about this issue is that many people have spoken, they are all spoken well. But my own point is this. For example, we are on like a pregnant woman that they said went to hospital in Lagos, something like that. They didn't treat her. They asked for 500,000. She should have gone to general hospital instead of private hospital. Because this private hospital, they have a target. They have money. They have to pay salary for other things. But when you go to general hospital, they could have treated that woman there. That's number one. Number two, in my own state, in those states, a woman gave birth to triplets, all three boys. The husband is a bricklayer. The husband ran away. He ran away completely because they gave birth in a private hospital. So, but people around there and their senator from that zone, Jima Ibrahim, rally around and pay for the bill, gave the woman money, everything. Probably not the husband will run back again because the husband maybe is not expecting that the wife will give birth to triplets. So, but my advice to people is this. When you want to get your wife pregnant or whatever, go and work very hard and get money. It takes money. It's not free. That's the nature of our country. In UK, it's free. Medical is free for everybody. So, but unless you are immigrant that doesn't have paper. If you don't have paper, then you have to pay. But they will treat you. Then you pay the money later. But if you are a citizen or you have your paper, it's free. All medical is free. You understand? But in Nigeria, it's not like that. It's supposed to be like that. But since it's not like that, the government should make a law that anything emergency, either you are private or they should attend to that person first. No life must lost. And they should put every penalty on these hospitals. That is how they can understand. Because you don't take it with levity hand. Soul has been lost now, which is very sad, like other people have been saying since. So that's my advice. If the government can, do something about this thing, it will be better. But above all, look at during the time of COVID. People didn't sick now. Why is that? People didn't fall sick. So people should try and manage themselves not to fall sick. But only God can protect us.
Indeed.
God bless Nigeria.
God bless Nigeria.
Enjoy your weekend.
Thank you so much, Adi. God bless Nigeria indeed. Imagine there are laws in place on that, but the problem is we know how laws are in Nigeria. Do they really govern and hold those accountable at the end of the day? Well, let's take the WhatsApp messages we have this morning. We have the first message from Paulinus M. Kasua. He said, "Good morning, Trust TV and Lilian. Respect for humanity has gone and replaced by the quest for money. Not only in the health sector, but all other sectors, be it education, judiciary, politics, religious institutions, etc. Why not render the services and save life first before issue of payment as a matter of emergency? The medical chiefs of such hospitals should be prosecuted on count charges of killing innocent souls. Indeed, if we had a legal system that was functioning, or we had a legal system that prioritizes such cases, or a speedy legal system, we would have seen a lot of that. A legal system where the common man has hope in would have seen such cases being taken on." The next message, he didn't put his name. It seems we've lost our sense of humanity when it comes to rescuing human life. Are we going to be asking pay before service when it comes to rescuing a soul? Many innocent lives have been lost because of these policies. Indeed, indeed, indeed. Now to the next message we have this morning. He says, then another issue, if patients don't know what, I think we'll have a problem taking that message. Let's move to the next message. Says, "Good morning, honorable journalists. This is Michelle Amos Mekanti from Sokoto State, Birnin Shehu. About the topic of the day, while ideally a man should have money in preparation for a child's delivery, the reality is that the average person's finances have been severely weakened over the past few years. How many can afford an emergency of 500,000? True. How many Nigerians can actually afford an emergency of 500,000 naira? May we never face financial burdens beyond our means. And the hospital is not running on water, but fuel, and staffs are not paid with leaves, as you said earlier. Indeed, I wouldn't condemn the hospital completely, but all these is a result of a failing system. 500,000 for an emergency is quite alarming. How many Nigerians can actually afford that in a sitting?" All right, let's take the next message. I believe that was put up there from Dr. Livingstone Ekanem. He said, "Good morning, Lilian. I'm still in pain that we had to lose our fellow country people in such gruesome manner in Uromi. I am further pained that 20 fellow countrymen and women have been murdered in Bokos of Plateau State within the last 2 weeks, and everyone is quiet. No coverage in our dailies, no condemnation from all corners of Nigeria, no call for justice. It's a sad day indeed. And it is a general attitude towards life that reflects in how Nigerians are treated in the hospitals. If we generally place premium on human life in our country, even health providers would act accordingly." Each time I see it, I ask, what exactly is the value of a Nigerian life to our leaders? What is the value of a Nigerian life to our leaders? Because if lives are valued, things will be put in place to make sure lives are safeguarded and protected at all costs. We have the next message from Julius Folari Mishola. It says, "Good morning, Trust TV. Pay before rendering service to a sick person in Nigerian hospital is a heartless and wicked culture which must be abolished at all costs. Government hospitals have been reduced to an ordinary clinic center where there is no empathy, compassion, and love to the sick people. May our government wake to the reality of giving priority to the welfare of her citizens." Indeed, when you talk of empathy and compassion, and then when you see the workload that is being placed on the doctor, I was conversing with my husband a few days ago, and I was like, I remember the last time I visited a general hospital, and I saw the mammoth crowd waiting to see the doctors. They had 3 consultation rooms. That's 3 doctors waiting to see patients that I was number 200 and something. And I was wondering, would this doctor still function after 11 p.m.? Because this is the mammoth crowd of people that are here to see him. The office was stuffy. There was no fan. There was no AC. It was hot and stuffy. How would that doctor function? Where would the passion and compassion come from if you're working in such an environment? So the entire healthcare system needs a full reform and investment. And, you know, for compassion to come to play, you have to even be working in an environment that is workable for you. Somebody will come in sick. You are mentally drained. You're not being paid well. And where you're sitting to work is hot. Where is the compassion? Where would it come from? You know, a lot. It's a lot. It's a two-way string. And sometimes I don't blame the medical doctors or the hospitals wholly, because I know that, and we all know, and that is the truth, that the working conditions for doctor is nothing to write home about. The cost of running business and running a hospital is nothing to write home about. If this hospital decides to prioritize giving care and services, what will happen to equipment that are being needed to also provide more services to the people? Equipment are being, a lot of things needs to be put in place. What will happen at the end of the day? So indeed, it's a roller coaster, and it's a lot to unpack in general. So we hope that at the end of the day, more investment we put in our healthcare sector, more investment we put in doctors and, you know, caregivers, and at the same time, the health insurance scheme needs to cover a wide bracket of people. So a lot needs to be put in place, and also the attitude of Nigerians towards this hospital as well. So it's a holistic approach from all angles. There's a lot to unpack. There's a lot to talk about this, and we hope we would have expand more on it. But unfortunately, we've come to the end of this segment.